Hi, my name's Manoj Krishna. I'm a spine surgeon. I'm going to tell you the story of John Sedgwick. What's interesting about John is that his MRI scan showed very little evidence of disc degeneration despite the severe pain that he was experiencing and he'd had for 3 years. As you can see on the scan with the arrow, the height of the bottommost disc is slightly reduced. We then did a lumbar discogram where we put a needle in the disc and found that the bottommost disc was degenerate and painful despite the normal MRI scan. And after a detailed discussion, we decided to proceed with surgery, and John had this less invasive posterior lumbar interbody fusion at L5S1. Here's John in his own words. John, good morning.
Good morning.
So can you start by telling me how old you are, John?
Yes, I'm 48.
Okay. And tell me a story about your back, please, John.
Probably 3 years prior to the operation, I was suffering some lower back pain, and that progressively got worse and worse. It affected my exercise routines, my quality of life, my day-to-day, getting out of a bed on a morning and feeling like an old man. And I went to the doctors, and the doctor referred me to yourself.
Okay. What other aspects of your quality of life were affected?
It wasn't really a state of depression, but it would get you down. Your lack of mobility, bending down, fastening your shoes, some of the more mundane things that you just take for granted were affected. You'd be in pain fastening your shoes. And
what about sitting?
Sitting, yeah, I could sit for towards the end prior to the operation. I could only sit for about 10-15 minutes before being in a fair bit of pain.
Okay, and then you had some other treatment. You had some physical therapy beforehand?
I did, yeah. I had physio for about 4 or 5 months.
Okay.
Which was a sort of a Pilates-based physio, which didn't make it any worse, but didn't really improve the situation.
Okay.
Hence me coming back and speaking with yourself.
Okay. And we did and I think what was unusual about your case was that the MRI scan didn't really show any obvious disc degeneration. So we had to do this test called a discogram, where you put a needle in the disc and we confirmed that disc was painful.
Yes.
So you had your surgery now 3 months ago.
Yes, yeah.
An interbody fusion at L5S1. So please tell me how you're doing and your recovery from the operation.
Yeah, I'm doing well. No more back pain, slight discomfort, but that's really as I'm trying to get myself a bit fitter. I went back to work after 3.5 weeks, albeit on a part-time basis. And just really got myself more active in my day-to-day routines rather than just sitting around and moping about.
Okay, and tell me how quickly you started, how long did it take you, for example, to walk a mile?
I was walking a mile probably after 10 days.
Okay, and driving?
I was driving within 2.5 to 3 weeks.
Okay, and how long?
So I pretty much stuck to ibuprofen and paracetamol, and I was on them for probably 6 to 8 weeks.
Okay, and now you're back to the physical activity and.
Yeah. I come to physio once a week. I think that will continue for another 3 or 4 weeks. I do the exercises that they've asked me to do every day, every morning, first thing. And I'm starting to do a little bit more now. I'm at the stage where I can maybe go on a cross trainer. I go on my bike 2-3 times a week, and pretty soon I'll be getting out doing the normal stuff, jogging, swimming, that type of thing.
Thank you very much.
Thank you.